Hello, good morning, friends. Myself, Dr. Shubhankar Kumar Singh. Today, we are going to talk or we are going to learn very important topic related to dentistry and medical fields. That is consent in dentistry. My dear friends, if you are not taking consent, means you are on risk. Whenever any medical legal cases happen, the court will first ask, where is the consent? So, my dear friend, consent is very important. Now we let come and we learn what is consent and what all requirements should be there in consent. It is mandatory. So, consent means now come to the introduction. Means introduction, that is consent is a legal and ethical requirement before any dental procedure. Means whatever treatment you're going to start, you should be legally or ethically requirement. You must have to take consent. So what is the definition? Consent is a voluntary agreement by a patient to undergo a procedure after understanding risks, benefits and alternatives. Means is like a one agreement between the patient and the doctors. So you should or you must take consent before any dental procedure and all the things mentioned in the your consent form. So what all types of consent? That is implied consent, express consent and informed consent. Implied consent is nothing is when patient agree to sit on chair and open your open mouth for your examination, that is called implied consent, means cooperate voluntary. Then second comes express consent, where verbal or written agreement for any procedure. Then third is informed consent. This is very important. It's your detailed explanation of procedure, risks, benefits and alternatives. Means your entire treatment details should be mentioned in the consent. What all risks are there, what all benefits are there, any other alternative procedures is there. You should or you must mention in the consent form. Then components, what all components is valid for consent? That is competence, means able to give consent. If patient is not able to give consent, its consent is not valid. Then voluntariness, give freely. There should be no pressure or any like you must have to give. That is patient rights. Whether they given freely, it means is valid consent. Adequate information, must explain all the things by dentist or doctors. Means what all treatments require, you should explain to the patient, and what all risk benefits any alternative treatment you must mention in the consent form. Understanding, must understand what is explained. Understanding means patient which language know, they should the consent should be in their language, because if patient not understanding your consent is not valid. Then age of the consent, adults 18 plus year they can give a consent, minor require parental or guardian consent. Then consent in special situation, if any situation comes like emergency, mentally challenged patients or unconscious patient. In case this all special situation, documentation, always maintain written consent form for major procedure. Any major procedure you should be documented properly. Always maintain written consent forms, and these forms and all the documents you must preserved for at least 3 years. That is law according to the medical legal. So, my dear friends, if you are not taking consent, start taking consent for the future. Then is the legal importance. What are legal importance? Protect dentists from legal issue and ensure patient rights. Means, just now I spoke about medical legal. That is medical. In case of medical legal issue, the dentist can be protected with the consent forms. What all include in consent form? That is, first is the patient identification. In that, full name, age, address, contacts, OPD number, ID proof, any is there, that is optional. Then diagnosis. What all diagnosis you done, you should mention there. Then nature of proposed treatment. The treatment, what all treatment you are going to do, what is the nature of the treatment, you should mention there. Procedure details you should mention, how this procedure can be done, what all risks and complications are there, you should or you must clearly mention there. And benefits of treatment, alternatives to treatments, what all treatment alternatives are there, consequences of no treatment, अगर नहीं, if they not going for treatment, what all consequences comes. Then financial consent, you should mention there how much cost will be there for the treatment. Anesthesia, if you giving, you should take consent. Then medical history you should mention. If you taking any photo or video consent, you should take consent. Right to ask question statement, voluntary consent statement, no force or pressure. Signature section, you must take signature, patient signature, doctor signature, witness signature, very important in India. Date and time, consent from minors if there is there, then parent guardian name or signature will be there. Relationship should be mentioned. These are very important points. Suppose one case comes, extraction without consent. One tooth you extracted without any consent. Means what happened issue? No informed consent. So learning, always take written consent before invasive procedure. Then RCT complication. During RCT, we know file separation most commonly occurred. Patient was not informed prior. Lack of risk disclosure. You should mention there. Learning, explain all possible complication before treatment. Minor patient, 15-year-old patient underwent extraction without parental consent. Sorry, not 15 year. This is 1.5-year-old patient underwent extraction without parental consent. Invalid consent. Consent will be an invalid. Means learning always obtain guardian consent for minors. Implant failure. If comes implant failure, implant placed successfully but failed later. Patient claim negligence. Issue, no documentation of risk explained. Learning, document consent including failure possibilities. Language barrier. This is very important. Patient did not understand English consent form. Issue, no proper understanding. So, use local language, that is Hindi, for consent explanation. Any cosmetic procedure you are doing, smile design, patient unhappy, unrealistic expectation, issue comes. Learning, use informed consent without expected outcomes clearly explained. Any emergency treatment, unconscious patient treated without consent, issue, emergency exception. Learning, consent not required in life-threatening situations. Any withdrawal of consent, patient asked to stop treatment midway. Patient autonomy. Learning, respect patient rights to withdraw consent. Now comes to the conclusion. Consent is not a just form, but a communication process. So, my dear friends, if any case files against you, what will do? So, better take care beforehand. If you have taken indemnity insurance, this can prevent you from any medical legal cases. If you don't know anything about indemnity insurance, just Google or talk to your insurance company like Policy Bazaar and some other company. They will provide you. It is very safe and hardly 1000 or 1500 per year will be charged. So, my dear friends, if you are not taking consent, start taking consent and protect you or your clinic for further any issue. Thank you. If you have any question, you can ask in comment box or you can mail me. Definitely I'll try my best to answer you. Thank you.